And, not to go off on this tangent, but I do have my peptide nerd shirt on. So I guess in a lot of these bowel cases, your autoimmune cases, which you have a lot of typically, and you're working on the cells and the efficiency of the cell, I'm sure you're going to be leveraging some peptides at the same time.
You got it. You got it. Yes, always. And so you're working on decreasing their inflammation, and you're at the same time working on improving their cellular efficiency. Depending on how inflamed they are to begin with, I'm always going to work on their inflammation first and then improve their cellular efficiency as quickly as I can after that. So you're probably going to get, it's layered on depending on how severe the patient's illness is.
Mm-hmm. So you have the healing component, you're going to have the building the good bacteria component, you have the cell efficiency component. And obviously these are going to be big because you do a lot of talks on autoimmune disease. So when you have an autoimmune problem, self-included, I've had the leaky gut conundrum scenario for a very long time. So I know personally when your gut goes sideways, how it can affect your ANA and any kind of immune status. So I'm sure that in your clinical practice, you are doing this a lot. You have a large group of some unhealthy clients or patients.
And it's amazing because, when I first went to medical school, I heard a lot of people that would come to me and be unhealthy. And I would say, well, it's just because your diet's bad and your exercise isn't right and your lifestyle isn't right and your toxic exposures and all those things. Well, then I started meeting people who were sick and we're doing all those things correctly. So that's where I am now is meeting people who are well, healthy, people you would be functioning well that don't use BPA plastics and put everything in glass or stainless steel or whatever, they're doing the best they can, not using dry cleaning, not exposing themselves to pesticides or herbicides, exercising on a regular basis, eating well, and yet they're sick. And so those are the patients we run into now.